watching TVC Breakfast, and we're talking cancer right now, a very deadly disease that's, if detected on time, can be nipped in the bud.
However, cancer is a deadly disease, but if detected on time, like she said, can be nipped in the bud. But in this report, Vivian Erikefe follows the story of a breast cancer survivor who says early detection saved her life.
An animation that shows how normal and cancer cells divide. A cell is the building block of life. Humans have about 100 trillion cells, and the human body is constantly producing new cells. Cancer cells are abnormal and grow rapidly beyond their unusual boundaries and spread to other organs. In Nigeria, it's estimated that more than 250,000 new cases are recorded yearly, while 10,000 cancer deaths are recorded annually. It's not all gloom about the disease. There are survivors. Oluwakemi is a cancer survivor. She was diagnosed with breast cancer 10 years ago. She says early detection and treatment saved her life.
Towards the end of 2004, the lump was removed. I was advised to take it to lab, histology lab. And I saw the results. Then I wasn't so sure. I said, where would I get it from? So I had to go to another lab and the same results again. So thanks to God, with the support of my husband, I did the mastectomy, that is the removal of the breast, affected breast, and started the treatment right away. I took chemo, which was not palatable at all. You all know the effects. It wasn't good. Then I did my radio. Then I was placed on tamoxifen for 5 years, which we have to take every day. And in between, some challenges here and there. It's not only the drugs or the treatment that matter or that makes one to survive. There are support groups that help. Like in my own case, Shebekli Cancer Care Center really helped. It's like a support group where we get support.
In Nigeria, breast and cervical cancers are the commonest among women, while prostate,
that is the removal of the breast, affected breast, and started the treatment right away. I took chemo, which was not palatable at all. You all know the effects. It wasn't good. Then I did my radio. Then I was placed on tamoxifen for 5 years, which we have to take every day. And in between, some challenges here and there. It's not only the drugs or the treatment that matter or that makes one to survive. There are support groups that help. Like in my own case, Shebekli Cancer Care Center really helped. It's like a support group where we get support.
In Nigeria, breast and cervical cancers are the commonest among women, while prostate is prevalent in men. This oncologist confirms that there are an increasing rate of cancer cases in the country.
Prevalence of cancer has been on the increase in Nigeria because of economic transition. One of them is exposure to tobacco. Tobacco has been found to increase the risk of cancer of every part of the body, and also change in diet. What people just need to know is that cancer is not, diagnosing them of cancer is not a death sentence, but they need to present themselves to the hospital at the early stage of the cancer.
Like humans, animals are predisposed to cancerous diseases as well.
Every tissue in an animal can have cancer. We have over 300 types of cancer in animals. The one that is very prevalent among animals, we have lipomas, cancer of the fat tissues. Is common with the breast cancer, just like in human beings breast cancer. We have cancer of the vulva, we call it transmissible venereal tumor. It can be transmitted from a male to another female.
Are they treatable just like in humans?
Yes, we do.
For this naturopathic physician, a holistic approach is needed to effectively treat cancer.
Cancer is in everybody because it's a problem of toxins. It's from the womb. Even from the womb of the baby, the mother inhales the toxins. As the baby is born, toxins continue. I think it's a problem of our environment. And as we continue to grow, the cancer cells tend to multiply.
Most cancer cases are said to be linked to modifiable risks like tobacco consumption, alcohol abuse, obesity, and lack of exercise. There are vaccines that can prevent some infections linked to cancer, including hepatitis B, which can cause liver cancer, and human papillomavirus, which causes cervical cancer. These people are waiting in line to be registered for the free general cancer screening organized by an NGO. This is part of the prevention and early detection measures to fight cancer in Nigeria. Although Oluwakemi lost her right breast to cancer, she is a living proof that cancer can be defeated. Vivian Irikefe, TVC News, Lagos.
Yes, it really is good to know that cancer is not a death sentence. Well, February 4 every year is World Cancer Day, but cancer is so serious that one day in a year is really not enough to draw attention to this disease that it's just taking out so many Nigerians. And more importantly, the attempt here is to create action, bring about action.
Well, the dangers there now is from experts we have heard in the report say that the prevalence of cancer is on the increase.
It is seriously on the rise. 2 million Nigerians have cancer as a 2013 report, 100,000 new cancer cases every year, and that's as at 2015. Nigeria records the highest cancer cases in Africa. All right. And that's according to the World Health Organization.
Yeah. Now with us in the studio is the Chief Executive Officer of COPE Breast Cancer Nigeria, Ebola Anozie. That COPE is Care Organization Public Enlightenment. Yeah. Ebola, good morning.
Good morning, Mike.
I understand you are true African. Sierra Leone, Congo, even in Nigeria, Lagos, Imo. Wow, this is great.
Delta.
Delta, exactly. So someone is going to say Ebola and Anozie, the combination of names. But however, it's good to see you.
It makes me feel like saying Oluwatoyin Alebu.
or Adamu Ade. All right. Now, we're discussing cancer right now. You have been involved in creating awareness about cancer. But if we narrow it down to everyday Nigeria, experts have said that the prevalence of cancer is on the increase. What do we need to know?
Unfortunately, we can't say why we have cancer, you know, the cause of cancer. But we only have predisposing factors, you know. And lately, we need to create more awareness. People are becoming more aware. And it's also very important to check the diet. A lot of us don't exercise. A lot of us don't eat well. We don't eat right. There's a difference between eating and eating right. So we need to do all that. Then the stress that we're going through, especially in Nigeria. You know, quite a lot of things come to play. It could be hereditary as well. So we have to, the most important thing is that if you catch it early and treat it early, it's not just catching it early, you know, detecting early. Some people detect it early and not do anything, you know. So it's important for you to catch it early, detect it early, and then go for treatment early. So those are very, very important factors that you have to look at.
All right. Every now and again, when we've had to talk about cancer here, especially breast cancer and all the other cancers, the question of lifestyle always crops up. But what about the environmental factors, really, come to think of it? In an environment like Nigeria, where you have carbon monoxide to contend with on a daily basis.
We have generators everywhere.
Coming from generators, from cars that shouldn't be roadworthy and all of that. Speak to that, you know, especially with,
You're very right, because you see, we have to take it from the top.
And the top would be?
The government. We need light. I'm sure you didn't sleep with lights.
You can't be sure of that.
Your generator was on?
Yes.
Through the night until the morning.
Through the night.
So that comes to play. Food as well. We have GMO. We don't eat well. Some of the things that we eat, take for instance, there are times have you noticed your carrots?
Mm-hmm.
Your carrots now become kind of...
It melts almost
melts.
in less than 24 hours that you buy it.
So all these things, the government should take a look at all these things happening. We're talking about agriculture. So the government should have a look at what exactly is happening, because most of the things we eat are not, some of them are GMO, genetically modified organisms. Some of them are not being processed, most of them are processed anyway. So we need to go back to the way we were, the way we used to eat, the usual, the normal, basic food. Organic. So we need to go back there, because most of the things we take are not, they're not rich. They're full of chemicals. So when we put chemicals into our system, the preservatives, the chemicals, and then they react in the system. So that's why it's very important that we take water.
Loads of it.
Loads of it. We try and move away from colored water, you know what I mean, soda, we get away from that. We try as much as possible to exercise regularly. Make sure you know your numbers. Try and see your BMI, your blood pressure, your sugar. Everything is important, so that when anything comes around, when you can nip it in the bud, like you rightly said. So that the most important thing that we're appealing to the government to do is to give us, honestly, a comprehensive cancer center. You reeled out some statistics. I'm certain that they're higher than that, because we don't have
conservative numbers.
We don't have a functional cancer registry. So everything is just okay. Let's just look at it. Let's prorate. Let's just say this. So it's very important that once we have a comprehensive cancer center, I'm telling you that, and then we create more awareness. We let people know that, look, you can come to these different centers to have yourself screened. It will go a long way.
All right. Now, if we have to narrow it down to some kind of specifics, creating a scenario where an average life in Lagos, for instance, a young man married with a very young family, you see how everyone is so busy. You wake up in the morning, you leave the house, and then you're busy. You come back later in the evening, you're working, your wife is working, children and all of that. That scenario, a lot of people will say, well, I can't go for exercises in that kind of scenario, and so on. And then if you put that on one side, and then another lifestyle in the villages, maybe Benue State or in Kogi State or in Taraba State, for instance, they're not the same. So viewing this, do you think that cancer cases can be more prevalent in the city of Lagos, for instance, or maybe Abuja or Port Harcourt than in other places?
It's a cosmopolitan state. Everybody is here. The lifestyle is quite different from the lifestyle you have in the village, because the village, you have fresh air, you breathe real fresh air.
Yes, at the age of 90, my grandfather was still going on. It was a palm wine tapper, and it was still.
Does he still tap?
But you would find out that a lot of people,
way
now,
into his 90s, he was still climbing the tree.
We have young ones who are dying early. We have 45. If you get to 70, just say thank God. Even 60 this day and age. So it's very important, because the lifestyle here is different. Now, you wake up in the morning, you go out, you have no time to eat, you have no time to rest, but it's important that you find time. Maybe on a Saturday, you probably might be living in an estate or something. Go and exercise.
Okay.
Do something different.
All right. We'll come back to the issue of the exercise and all of that. Let's go on a break and we'll come back on the program. But don't forget, at top of the hour, will be time for the news update. And Ni Oyelo will take us there. Stay with us on TVC Breakfast. We're discussing cancer right now.
All right, you're welcome back. We're talking cancer this morning, the alarming rate of cancer in Nigeria. Bonla Nozie is with us right here in the studio of COPE. She's the CEO of COPE Care Organization Public Enlightenment. Of course, very shortly we'll go on that news break. But before that, let's talk more about the things that we should not be doing that could predispose us to cancer as much as it is within our own control. You have the environmental factors that we touched on, high tensions everywhere, chemicalized synthetic food, and all of that. Talk to us more about the things we should not be doing.
I just say that you shouldn't smoke. Like I said, eat natural, organic food, exercise, stay away from stress, and make sure that every year you go and have your medical checkup. It's very, very important.
And when
thank
you
God
talk about
we see
medical
that
checkup,
a lot of
it's almost like you're saying you're talking to the more privileged people as against the less privileged. I mean, they'll tell you, where do I go to check myself up?
You go to the hospital to check it up. You go and have your sugar.
People as against the less privileged. I mean, they'll tell you, where do I go to check myself up?
You go to the hospital to check it up. You go and have your sugar, your blood sugar, your blood pressure, your BMI, you have your urine checked, you have just those checks.
All right.
You have your cervix.
We'll come back to that
breast.
because I think it's really interesting. People at that level, if they have to try to find somehow to get to
You don't have
accessibility.
to be up there for you to.
We'll come back to that.
We're talking about
yourself checked.
accessibility
Yeah.
here, but of course
Let's
we'll look at that.
go on a
when we
break.
come back.
All right, if you're just joining us, you're watching TVC Breakfast. On this segment, we are discussing the rate of cancer in Nigeria and what can be done. And we have with us the Chief Executive Officer of COPE Breast Cancer Nigeria, Ebola Anozie. COPE is a care organization, public enlightenment. Now, we also will be having another guest on phone right now, but before we go there, now cancer is a disease that has become a global burden, and according to WHO, the numbers of a new cancer case of new cancer cases is expected to rise by about 70% over the next 20 years.
Now, diet and lifestyle play a crucial role in causing cancer, or actually curbing it, which is why medical practitioners encourage people to maintain healthy lifestyles and also go through regular medical checkups. Cancer is the uncontrolled growth of cells which can invade and spread to distant sites of the body. Cancer can have severe health consequences and is a leading cause of death globally.
Now, some factors like early detection, accurate diagnosis, and effective treatment, including pain relief and palliative care, help increase cancer survival rates and reduce suffering. Now, according to WHO, an estimated 13% of all deaths worldwide is caused by cancer. The cancer is known to be the second common cause of death in developed countries and third leading cause of death in developing countries like Nigeria.
As a matter of fact, we hear that cancer kills more people than tuberculosis, malaria, and HIV all put together, ×3 of that. Now, the World Health Organization further says that more than 70% of cancer deaths occur in low and middle income countries. In more developed countries, death rates from cancer is declining due to prevention, early diagnosis, and better treatment. Well, unfortunately, this is not the case in many parts of the world, especially in sub-Saharan Africa. And health experts say women are at a higher risk of getting cancer, with more than 40% of cancer cases in Nigeria occurring in females. Available statistics in Nigeria show that the most common reported cancer cases are breast cancer, cervical cancer, prostate, colorectal, and liver cancer.
Now, Nigeria lacks accurate data on cancer incidence and mortality, but it is estimated that more than 100,000 Nigerians are diagnosed with cancer yearly, with a death ratio of 4 in 5 affected persons, one of the worst in the world. Now, in Nigeria, one major issue that has been generally identified as a setback in the fight against cancer is inadequate medical facilities for the screening and treatment of the condition. The alarming death rate in the country due to cancer underscores the need for government at all levels to make provision for cancer treatment centers across the country. We have our guest talking about that earlier on.
Yes, indeed. Now, according to the Committee Encouraging Corporate Philanthropy, CECP Nigeria, 30 Nigerian women die every day of breast cancer, while 1 Nigerian woman dies every hour of cervical cancer. And many forms of cancer, including breast cancer and prostate cancer, can be cured if detected early, while cervical cancer and liver cancer can be prevented through vaccination, and colon cancer is, of course, preventable. We have a medical doctor who will be joining us on the line from Lagos right here, Timitayo Olowokere. Good morning to you, and thanks for joining us. Let's direct this question to you then. Reports, experts like yourself say that Nigeria is not ready for the tsunami that is about to happen as far as cancer is concerned in Nigeria. What can we do to prevent this kind of health tsunami?
Yes, good morning. Thank you very much, everyone. You are quite right that there seems not to be on ground enough structures and strategic plans in place in the country to actually tackle the ever-increasing burden of cancer in the Nigerian population. So the measures that we can put in place, first is that we need to put in place structures that can help us to have credible data. As you rightly mentioned in your earlier presentation, most of the figures we have for Nigeria are estimates, which may not truly reflect the true picture or burden of these cancers in our population. So we need to work on getting credible data that we can use both for planning as well as for intervention. That is number one. Number two is also to increase the level of awareness of our unaverage citizens on the importance on the importance and the impact of cancer, such that they themselves can improve their health-seeking behavior. So we need to create platforms both within the social media space, within the regular media space, even within our health education activities to increase the awareness on these cancers. The importance of this is that if we were able to detect cases early, the possibility is that we can probably achieve a cure early. But in Nigerian environment, as you are also rightly noted, the cases are detected rather late. So even the possibility of a cure is actually is remote in most instances. Besides that,
talk to us, Dr. Olowokere, talk to us about statistics have shown that females are more susceptible to cancer. Talk to us about that. Why is that?
Well, a number of factors actually makes women vulnerable to cancers, much more than their male folks in a number of instances. Let's take, for example, cervical cancer. That's the second commonest cancer in Nigeria, both in terms of disease incidence as well as in terms of mortality. It's the second commonest. But it's a preventable cancer, which can be prevented with simple vaccination, at least to a large extent, as established elsewhere. So, but the key thing is that we know also that women are the only ones that have cervix. The male folks don't have cervix. And then a simple vaccination for a woman before sexual debut or even much after can still be of great immense benefit to minimize the incidence of these cancers in them, in that particular population. Besides that, women also are, for example, the way their anatomy and genitalia is constructed, particularly looking at cervical cancer now, put them at risk of prolonged exposure, to the HPV virus that has been implicated in this cancer. And then that is also increasing the incidence of this disease in them. So the key thing is that women, generally, because they are not as empowered as men to even seek intervention when to seek care, to seek appropriate intervention, just like their male folks, due to various factors, both cultural and socioeconomic, and this put them at a disadvantage to even seek care. So we tend to have more incidence of cancers in them, particularly at advanced stages, as compared to men who are more economically buoyant and can seek help much earlier where this needed, when these are needed. So these are some of the key contributors that put women at a higher disadvantage of the burdens of this cancer than in the male form.
To that, there is no government policy as far as cancer is concerned. And of course, the fact that the National Health Insurance Scheme does not even cover cancer, how does that further complicate matters as far as tackling cancer is concerned in Nigeria?
We'll make you answer that
yes,
after we go on a break now. Stay with us on the program.
So you were responding to the question I directed.
Yeah, like he rightly said that no insurance company would cover cancer. Because if you look at the treatment of cancer, it's very expensive. Take, for instance, when you have some medications that I mentioned earlier on.
Scary figures.
Yes, 750,000. Who's going to do that? And then you're giving about maybe you have about 12 or so to buy. You multiply that. So it's pretty expensive. And then if you look at what we have here in Nigeria, how many machines are working? How many radiotherapy machines are working? Yes, go to the hospital today and say you need your radiotherapy done. You probably might be given an appointment maybe March, earliest.
Why
if
is that?
April.
Because
we
it's
have
booked
quite
already?
a lot. Yes, booked.
People are booked?
The people are booked, and then most of the machines are not working. So that comes to play as well. We have doctors who are willing to work, but they don't have tools to work with. That's why it's very, very key. It's important that we have a comprehensive cancer center. You can have a cancer patient and someone who has malaria going to the same place, so that we pull that out, and then we have a place where cancer patients can go and be monitored and treated early. You know, so we have some patients that come to us because we run what we call a support group, and then we have a screening center. Now, ask women to come for screening. They will tell you they have a party to attend, or they have a function to attend. Just one Saturday in a month, every month for you to check your breast, they will tell you, oh, maybe the following one. And they would never come because Nigerians actually present late.
And that's a major factor why the death rate is very high. It's very important
because once you come late, what can the doctor do? And then you start looking for a miracle. Some of them, you ask them, okay, this is available for you. They will tell you it's not their portion. Whatever it is, there are quite a lot of tufia, a lot of things that they say. Whose portion is it? But there are a lot of places available for you to go and have your screening done. Make those...
Take advantage of those
things.
Okay, we'll come back to this. Let's have Foladili on here now to give us a perspective of the reaction of Nigerians on social media. Good morning. Good morning.
Good morning, Aboliwa. Lovely to see you. Okay, so, I mean, this is a very sad one to hear that cancer is getting bigger. It's not getting better, if we're being honest with ourselves. So let's see some of the concerns that are being raised online about this one. Okay, Made in Nigeria says more and more cancer survivors in Nigeria should be more vocal. Together we can reduce the mortality rate of this menacing disease. Okay, Buameme says increase in cancer rates in Nigeria is becoming alarming. I lost my dad to cancer last week. TAS says, for example, the Netherlands records a 92% cure rate, while Nigeria has less than 20% cure rate for childhood cancer. Ruthless Analyst says, soon the rate of people coming down with skin cancer and renal failure will skyrocket in Nigeria, these bleaching creams. Okay, George Uwaifo says, why is there a sudden prevalence of cancer cases in Nigeria? Is it that diagnosis has improved or something changed in our diets?
Very good question.
Yeah, is it that diagnosis has improved? Is it that they have things that can we have, you know, better science that can detect these illnesses and diseases now, or is it that something has changed in our diet?
Something has changed in our diet, obviously. It's very.
She talked about that.
I talked about it, you know, because a lot of us don't eat well, and then we are not eating the proper food. did you see the video that was passed, how rice is being made
Plastic
in a
rice.
Plastic rice and all that?
That
so
one
the
is
government has
unbelievable.
to, you know, put a rein on all these things being brought into the country. Nigeria is not a dumping ground. They dump a lot of things here, and then we just we consume them without having to check if these things are organic or inorganic.
Okay, so because Mike said you spoke about that earlier, let me take you up on something that I heard you talking about just before I came on, and it was about screening. And I was talking to one of the guys in our studio earlier, and he said, "Have I gone to get myself checked for cancer?" And I said, "Well, have you gone to get yourself checked as well?" And he said he hadn't. And I said, "Well, why are you focusing on me alone?" And he said, "Well, because there are more cases in women." So what would you tell men who think that maybe it's just women that deserve to get tested? What would you tell men? Because you talk about prostate cancer in black men, you talk about the other forms of cancer that are prevalent in men. So what advice would you give
It's
men?
the same thing. It's in whether you're a man, whether you're a woman, you should have yourself checked every year. Just give yourself that birthday gift. Once it's your birthday,
Go
at
check.
least, go check. Give yourself that present and say, okay, I want to have myself checked this year. So that if there's anything, you can nip it in the bud.
Okay.
So PSA test is there. You can easily do it. Breast cancer, the breast examination is there. You can use your breast self test. You can use the ultrasound. You can use mammogram if you're over 40. You know, there are quite a lot of things available out there. But Nigerians don't take action. We're never proactive.
Yeah,
All
that's
right,
the
Fola.
unfortunate thing.
Thank you. Thank you very much.
Thank you.
All right, let's get to, we still have Dr. Oloekere with us on the phone. Now, Doctor, you have been working with patients who will come to make complaints here and there. But give us a perspective. How aware are Nigerians when it comes to the knowledge of what to do to prevent cancer and how to go about things?
Okay, thank you. Just to say that awareness is still low, but it's improving. Today, you have people that can come forward and ask some basic information. Haven't seen one poster, haven't seen one banner, haven't had something on the internet and all that. Increasingly, the awareness is getting better, but it's still rather low compared to the epidemic that we have on our hands. Today, we know that there are so many systems in place now with NGO, with government intervention, with a lot of online publications that is increasing the tendency for people to get to know basic things to do, where to go, and what services are available. A whole lot is being done. Unfortunately, we have some commemorative days like October Cancer Awareness Month, January, February for Cervical Cancer Awareness Month. All these are also helping to increase awareness in the population.
And how aware really are we about the factors in terms of what we eat? I mean, there's plastic all around us. Our guest just talked about the issue of plastic rice, which I still find very difficult to believe. Bottled water is mostly in plastic. Most of our foods have a link with plastic in one way or another.
Established and different kind of chemicals.
And all kinds of chemicals. I want us to talk more very quickly, if you can, how we can actually avoid using plastic in our food, maybe even in what we wear and all of that. Because really, it would not make sense not to talk about how it can be prevented in the first place and what we need to do to prevent it.
Yes, actually, in terms of the contribution of our lifestyle or use of plastic to cancer incidents, I would say that we actually need more local data that can speak to policy formulation. We know that there are data elsewhere that are that we can generalize, which is finding a bit of low acceptance among policymakers because they would rather appreciate the local data that can be better used to inform policy. And I think this is the link that we have not yet gotten right. The more of this we can get to the right stakeholders, for them to know what contributions the danger this cause, I think some broad initiatives will be put in place to address this concern. But for now, we still don't have enough local data that can help to speak to policymakers on these issues. So it's a major bottleneck.
Yes, indeed. Okay, so Bola, you have definitely the last say. The fact that supermarkets are springing up here and there is really not a sign of development. I would think it is. Because we don't get organic foods in these places.
The funny
Talk
thing,
about sugar.
The funny thing is that when we create, like Doctor said, when we create awareness, we get so carried away that, you know, we get so carried away in, you know, this pink, we're in pink, ask those who take part in most of the activities if they have actually checked themselves. But we're always so carried away trying to put on pink, do pink things and all that. It's a big deal out there in developed countries where the government is also there for them, and a lot of women come out, they make sure they're screened, you know. And when you go to the supermarket, it's very important, like you said, Ngozi, when you go to the supermarket, try and see what you want, if it's organic or inorganic. Maybe here we can't tell because
there's no labels. There are no labels.
We're actually prone to this Western lifestyle. Unfortunately, cancer cases are more over there, but they detect them early. Here, the mortality rate is higher because we don't detect early. So I think we should go back to the ofada, the things that we were used to, the local yam, but even at that, what they use in planting these things are all chemicals.
All right, Bola Nozie, thank you very much for coming on the program right now. Thank you.
Thank you for having me.
We also thank Dr. Temitayo Olookere for joining us on phone. Thank you. Stay tuned now for the next. Thank you. Stay tuned for the next discussion